passive smoker. The first symptom was tingling in her arm when the cold air hit it, then numbness in legs, which she felt when went swimming and couldn't feel the coldness of the water. She brushed off those symptoms to being tired and stressed. Then the foot drop started. She would go jogging and halfway through, her left ankle would tear and she'll sometimes trip. Around that same time, her sciatica was acting up and her doctor ordered an MRI of the lower back. The diagnosis was spinal stenosis, which he said was causing the foot drop. She accepted that diagnosis, taking medication and getting cortisone shots, all while cutting her runs shorter and resting when needed. Then everything changed when she switched to a new primary care doctor in 2004. She had numbness on the right side of the abdomen at the time, and comment to the doctor her history of numbness, tingling, and foot drop. She put the piece together and sent Perla to a neurologist who ordered a new MRI, and then she was diagnosed with multiple sclerosis. Sensory symptoms as numbness, paresthesia, dysesthesia, and inflammation of the optic nerve, optic neuritis, are often onset symptoms. As the MS or multiple sclerosis has progressed over the years, she needed to use more assistive devices. She had an ankle-foot orthosis, used a cane for a while, and now uses a rolling walker full-time. Her shower has a bench and a grab bar. She has rails for her toilet and on the couch to make standing up easier. And she had her car modified with a knob on the steering wheel, for instance. She had always had several urinary infections through her younger life, maybe 3 or 4 per year. But during the early years of the 2000s, she started to get those much often. She met her actual husband then, and she had more regular sexual activity more frequently, which always used to lead to a new urinary infection. So she thought that was why. Now, looking back, she understands this repeated urinary infection was due to multiple sclerosis. Looking back, you'll say she has primary progressive multiple sclerosis. It's called this because from the first symptoms, the disease is progressive. It's usually diagnosed in people in their 40s, but Paula was a lot younger than that when she started to notice something was wrong. Early symptoms with primary progressive multiple sclerosis is often subtle, like sensitivity symptoms or problems with walking, which develop eventually over time. There will usually be few or no relapses with primary progressive multiple sclerosis. Disease-modifying drugs treat the underlying condition or change the course of the condition itself. There is currently only one disease-modifying drug called Ocrevus or ocrelizumab, available for people with primary progressive multiple sclerosis with some requirements. The multiple sclerosis must be active. The patients had it for 15 years or less. The patient can walk at least 20 meters with or without a walking aid. I want to add that multiple sclerosis patients used to complain about urinary urgency, polyuria, nocturia, etc., We know that urinary retention and incontinence is common features in multiple sclerosis. And this first one favors the development of urinary infection. Escherichia coli, Pseudomonas aeruginosa, and Klebsiella pneumoniae were the most found organisms, and treatment is based on antibiotic therapy. Moreover, urinary tract infections can worsen the disease, causing more damage and severe neurological condition deterioration. In addition, urinary tract infections in this group are associated with high hospitalization rate and a high mortality rate. Therefore, patients in multiple sclerosis outbreaks with urinary symptoms or positive urinary release must keep corticoid therapy and disease-modifying treatment. Whether clinically stable or multiple sclerosis relapse patient, the urinalysis and the presence of symptoms must guide the treatment in each group. Nevertheless, the pharmacological treatment of asymptomatic bacteriuria induces a significant increase in more resistant bacterial strain. It is recommended just under pregnancy or patient in need of immunosuppressions. Bladder symptoms can usually be managed successfully with lifestyle modifications, medication, physical therapy. Her husband is trying to quit smoke, and he does this and is not smoking for periods of time. She takes also baclofen, laroresal, 30 milligrams twice a day. She had been using antihistamines for a fall sleep easier in the past, but she does sleep well without it or any other medication at the current time. Some words about baclofen or laroresal. Studies show that baclofen inhibits both mono and polysynaptic reflex transmission by stimulating GABA B receptors in the brain and spinal cord through hyperpolarization of presynaptic neurons and inhibition of monosynaptic and polysynaptic reflex. It is so that this mechanism inhibits the muscle stretch reflex that underlies spasticity triggered by upper motor neuron disease, and that include, for instance, cerebrovascular accidents, amyotrophic lateral sclerosis, primary lateral sclerosis, multiple sclerosis, Brown-Séquard syndrome, and vitamin B12 deficiency. This leads to a reduced release of the excitatory amino acid glutamate and aspartate. Neuromuscular transmission is not affected. Baclofen exerts an anti-nociceptive effect and reduces painful spasms, automatism, and clonics. Perla is very committed to her health and does what she can to stay as healthy as possible. Eats well, exercises daily, and she tries to have healthy routines. I hope this video has caught your attention. This presentation is entertainment for students and health professionals who want to listen to studies, discussions, or clinical cases. It is not intent in any way to replace the learning provided by reading medical literature or the experience provided by clinical practice.